Nikarealize ya kwamba the room was dark. So
baada ya wiki mbili
nikauliza mwenye the caretaker, kwa nini mumezima lights? Akaniambia tujazima lights. The lights iko hakuna lights because it is still.
Hello everyone, this is Dr. Chirchir, the director of Utu Glogoh Hospital, which is based in Eldoret. And today, on the 29th of July 2023, we are with Caroline Kombich, who was my patient in 2009 when she had a condition that we call preeclampsia. Preeclampsia is pregnancy-induced hypertension that occurs as a result of a placenta implanting onto the uterus in an abnormal way. Scientists and the medical professionals have not determined exactly what makes these placentas to implant abnormally in a manner that it leads to hypertension occurring 20 weeks and above in pregnancy. So we are focusing ourselves today on preeclampsia and eclampsia. So eclampsia is when a pregnant woman with preeclampsia or pregnancy-induced hypertension that is characterized by high blood pressure and passage of protein in urine, which is in medical terms called proteinuria. So when such mothers develop seizures because of very high blood pressure that affects their brains, then they are said to be having eclampsia. So without much ado, would like to introduce Caroline Kombich to tell us exactly what happened in that year of 2009. Welcome, Caroline. Kindly tell our viewers what exactly happened.
Good afternoon, everybody. My name is Mrs. Caroline Kombich Ejikon. I suffered preeclampsia in the year 2009. I developed high blood pressure on the 1st of April 2009. And I went to the hospital. The doctor saw me and she prescribed for me some medicine and sick of. So I went and stayed at home for some time and I went back for review. So for the review she gave me another 3 more days. So on 10th of April 2009, I was still on my medication. So on that 10th of April, and I was just in the house, and in the evening, I realized that my legs, they were swollen. So I took the medicine and I rested again. And at around 11 p.m. at night, now I felt like I was not feeling well because I had now severe epigastric pain.
That is pain in the upper part of the abdomen. Yes.
So this now prompted me to go to hospital, to call for somebody to bring me to the hospital.
Yes.
On the way, I called Daktari. We met in the hospital, Memorial Hospital.
In Eldoret.
Eldoret.
Yes.
And Daktari took my blood pressure, which was very high by that time. And he advised me we go to Medihill Hospital.
Okay, that was because there was a the drugs to reduce the blood pressure were
Not
unavailable at that time. And we called Medihill Hospital and they said they did have that particular drug because the blood pressure was very high, extremely high. Yes.
So as we went outside, in the I think in the car now, I became unconscious. So we went to Medihill Hospital. I think they received me now because I was not able to coordinate or.
You're not very conscious.
Yes.
You're not fully conscious.
So now they took me for emergency C-section. And in the morning now when I woke up, I couldn't feel my right side of my body. So I was asking even my sisters, can I sit there?
What may have happened?
What is happening? Where is my leg?
Yeah.
So they called the doctors and the doctors again came and checked on me. They realized now that I had paralyzed my right side of the body.
Yes.
So
we undertook an emergency cesarean section because the treatment for preeclampsia, the definitive treatment for preeclampsia is delivery. At the time, her blood pressure was extremely high, and she was getting the blood pressure was affecting her brain, and it was also affecting her liver, and that's why she had upper abdominal pains. And the treatment, of course, was emergency cesarean section, which we did and managed to save her baby. We thought we had saved her, but apparently she had developed brain affection due to the very high blood pressure. Yes, so can we continue from there?
So I stayed in Medihill Hospital for like 2 weeks. The doctors managing the high blood pressure, and
and the baby was also in the
nursery. The baby was okay. The baby was fine. He was weighing 2.2, so I think he was put in nursery.
Okay.
So, but they used to bring the baby for me to breastfeed.
Okay.
So I could see the child, and on 28th of April. At around 3 p.m. That's when I woke up and I realized I was not able to see anything. So I called out for the caretaker too, and I was asking her why the lights were off. So she told me lights were not off because the sun is not shining outside. And I now went back. I fell back into, I think,
you
coma.
went into coma.
So
later on you realized you had been taken to Moi Teaching and Referral ICU.
And so they called the doctors, and the doctors came and they transferred me to Moi Referral Hospital ICU, where I was admitted for 5 days in the ICU. And on the 6th day they discharged me from the ICU. And I was discharged to the wards.
Okay, were you able to see at that time?
So I lost my sight on that 28th.
And you never recovered your eyesight up to now? Okay. What have they told you was the cause of loss of your eyesight?
The doctors told me it was because of the accidental hemorrhage that occurred in the brain. CVA.
Which was caused by the very high
blood pressure.
Okay, so and the part of the loss of your vision is because the part that processes vision in the brain is the one which was affected, which is the back of the brain, which is, in medical terms, we call the occipital region of the cortex of the brain. This was very tragic. You did not recover fully, I think you say, for about how many years?
Like 5 years.
So it took you like 5 years for you to be in the current state. What exactly happened? You were paralyzed on the right side?
Yes.
Uh-huh.
I got paralyzed on the right side of the body.
And you had lost your vision.
And I had lost my vision.
And head?
I had lost even sensation in the head, loss of taste, loss of smell.
Wow.
I had all those.
So, really bad complications. Polly, really sorry about that. So, she's lucky, and we are all lucky. A number of mothers do lose their lives. Preeclampsia is the number 1 or number 2 cause of maternal disease and death, and perinatal or babies disease and death also. So we say in medical terms that it is one of the top 5 causes of maternal and perinatal morbidity and mortality. And so we are lucky that she didn't get the mortality, but she got very serious morbidity arising from preeclampsia. So much so that now she is blind and she cannot see, and you lost your job. After how long?
Now, when I was immediately after the delivery, they gave me 3 months of leave.
Yes.
After the leave, they added for me some months.
Yes.
So the leave ended in December. So they advised me to take unpaid leave for 1 year.
Okay.
So they gave me unpaid leave for 2010, the end of 2010.
Okay.
And 2011, January, the leave was over. So they called me, and that's when they advised me now that because now I've lost my sight, so it was better for me to just stay at home.
Okay, so, and that was very painful, isn't it?
Yes, but because I was still sick again, I didn't even realize the impact of losing the job fast because I was still very sick.
Your main concern was to recover, not to be employed. And you used to work at the Moi Teaching and Referral Hospital as
a clinical officer.
So, viewers, it's very important to realize that even healthcare workers do get affected by this condition. It's a condition which I call one of those conditions that human actions or inactions do not contribute to their acquisition. And that's why, as Utu Glogoh Hospital, we are interested in this particular condition, because no one chooses and it spares no one. It's a disease for everyone, regardless of who you are. It can happen to anybody, and in any pregnancy. She had 2 previous pregnancies before this condition, and she didn't have high blood pressure or preeclampsia in the first 2 pregnancies. It's in the 3rd pregnancy that she suffered this particular condition. So something else happened in 2011.
2011, it was also a
very
sad year
moment
for us because that's the time I lost my husband.
And he was a doctor. Dr. Ejikon used to work for Medicine Sans Frontiers at that time. Doctors Without Borders. And I remember he was he in Sudan at the time?
He was in Juba, but he had left MSF, so he was working for the UN.
Oh, for the United Nations. At the time you had this preeclampsia, he was in South Sudan, in Juba. And then eventually he passed on in 2011. It's just 2 years after the preeclampsia, cerebral or brain injury that led to stroke and blindness, arising from this condition we call preeclampsia. So since then, your child grew up. Where is he now?
The small boy.
The child that you delivered through cesarean section.
He's now a big boy, 14 years of age.
Yes.
Studying in Kapsabet Boys Secondary School, high school.
Yeah, and you told me he's quite bright,
Yes.
despite the challenges. That is the good part of life sometimes. Tends to compensate for what you lost. He was number 1 in the whole of
Nandi County.
Nandi County. And now in Kapsabet Boys High School. But he had a problem.
With the right eye. So he also had headaches since he was age 3. Persistent headaches. So we used to go to hospital every now and then, in and out of hospital, until 2016. That's when I went to Dr. Can I name names?
Sure.
Dr. Ogado.
Yeah, a pediatrician.
Yes.
Yes.
He's the one who was seeing him. And I was like, now, Dr. This problem has persisted for long, so please do something. So he told us now we have done everything.
Yes.
So we go for ophthalmology review,
Eye specialist review.
Assessment. So we went. He sent us to Optica, where now the people in Optica said we go to ophthalmologist.
Yes, consultant eye specialist.
So we went to Dr. Odede.
Yes, in Eldoret.
He diagnosed. I don't remember the diagnosis, but he said the right eye was not able to see. So he prescribed some specs.
Yes.
For him. So he used spectacles since 2016
yes.
to 2019, where a friend of mine called me and told me there's a doctor in Nairobi. He was calling now on my behalf, telling me for myself to go to Nairobi for the doctor to see me.
Yes.
So I decided, since the child also had a problem with the eye, well, let me wait until they close school so that we go together.
Oh, so actually you are being asked to go to Nairobi because of your eyesight.
Yes, yes.
But you decided to go together with your son so that both of your eye problems could be checked. Okay.
So we went to Dr. Mukesh.
Yes.
He was in Sarit Center.
Yes.
So he saw me and he told me the problem I had, it was irreversible.
Yes, because it's brain damage.
Affected the nerves.
Yes.
So he said for Cedric, he will do laser eye surgery.
Yes. Later on we learned that it was a problem, laser corneal surgery. And now he's able to see with that eye.
So since then, he has been just getting headaches on and off.
He's improved, but still gets some headaches.
They improved the side by, the doctor said improved by 86%.
That's great. That's good. So that's a good side of healthcare. Some conditions can be treated. Some conditions like preeclampsia is still unknown to us, the medical profession, as to why it happens. But we treat the complications and we know treatment is delivery at the right time. Thank you very much, Caroline Kombich, former clinical officer of the Moi Teaching and Referral Hospital. You are an ENT specialist clinical officer. We really appreciate Asante Sana for coming to Utu Glogoh, so we can talk to mothers. So what would you like to tell mothers about preeclampsia?
I want to tell mothers, now that I've realized the severity of this condition, they should attend their antenatal clinics promptly and to take care. When the doctor say come on this day, do this, just follow what the doctor says. Follow your antenatal clinics correctly.
Yes.
And in case you have any problem, don't wait like me. Because I have a feeling that if I went to hospital earlier, they could have saved my eyesight. But now...
Yeah, but you should not blame yourself, because actually preeclampsia is a condition that is quite unpredictable. One time your blood pressure may be like normal, but within a very short time the blood pressure can really rise up rapidly and can cause such damage as the brain damage that you've had. The most important thing is to be close to hospital and control the blood pressure as much as possible, and if need be, as was the case here, delivery is instituted to save the mother, is undertaken to save the mother. The mother, of course, is a priority in this situation, and delivery can be undertaken anytime when the mother's life is in danger. So for everybody out there, everyone, all parents, all people who are listening to this, preeclampsia is a very serious condition that we all need to take it very seriously. We need to establish a center, a preeclampsia, eclampsia center in all our hospitals, but for this particular video, it is intended to enable you, help us to put a center at the Moi Teaching and Referral Hospital, working together with us, Utu Glogoh Hospital. We intend to contribute 20% of our earnings, of our profits, towards the establishment of the Preeclampsia Eclampsia Center at the Moi Teaching and Referral Hospital, and later do the same here for private patients. So we intend to establish a Preeclampsia Center for private patients in this hospital at the Utu Glogoh Hospital in Eldoret. Thank you very much for listening to us, and kindly pass the message about preeclampsia. Asante sana. Thanks, Kombich.
Thank you very much.
Asante.